So I was born in the 1990s, which means I don't use TikTok. So many people just got offended. No, but the other day, my mom was like, Steven, I have the best idea in the world. You need to start posting videos on TikTok because that's where all the action is. That's what you need to be doing. Like, yes. And I was like, Mom, I have a TikTok and I post there very infrequently because I don't know what I'm doing. I'm not a TikTok man. I've never gotten it. I used to use Vine a little bit. Shout out to 2016.
Get out, Mika!
Yeah, it's not really my platform. I do have one. You can follow me there, steven.p.ray.dentistry. But, so instead of being creative and actually posting things on TikTok, I'm going to react to TikToks on YouTube. So enjoy. For those of you who don't know me, my name is Steven and I'm a 4th year dental student. I actually only have 2 months left of dental school. I'm almost a dentist. So today I'm gonna be reacting to dentistry TikToks, which is interesting. I've never done this before. We'll see how this goes. All right, let's get into it. So we'll start with dentist and just see what's here.
I try to avoid talking to people. I even avoid talking to my wife sometimes because it's embarrassing.
So this is like a wholesome video to start it out with.
Really? Like, so you could smile again.
That'd be nice.
Yeah, and have confidence.
Very happy, yes. I told her, I said,
Oh yeah.
I'm tired of like feeling ugly. So.
First off, him saying I feel ugly or I don't want to feel ugly anymore, that is such a real thing. Like one of the reasons I got into dentistry is because people, like your teeth are so important on your overall perception of yourself. And if you don't like the way your teeth look, most people are going to be pretty unhappy with themselves. So the opportunity to take care of people like this that have a really bad or poor dentition after years of not treating themselves correctly, or maybe they didn't have proper oral health care when they were a child or whatever, the ability to give them a new smile like they did for this gentleman, that is fantastic. This is actually the type of video I want to do in the future when I start treating patients myself as a dentist. I want to do stuff like this, smile transformations, sick stuff right here. No idea what type of prosthesis they used here. I don't know if it's a conventional denture or if it's an implant supported denture. This is probably an all-on-4 if I had to guess. That's a really common 4 implants and a hybrid denture that goes over top. It's really common these days.
Don't bite, okay?
Don't bite. Bro, I hate taking impressions. Snap. That's pretty nice. For those of you who don't know, that is an alginate impression. We have to learn how to take those in dental school. They suck to take. Patients also hate the way they feel. We're moving away from alginate in dentistry. A lot of people are getting into scanners, which are these little basically camera looking wand machines that take pictures of your teeth instead of using an alginate impression material. They're super expensive, so they're not extremely accessible for all dentists, but that's the way dentistry is going. There will always be a place in dentistry for conventional impression materials. That's at least my opinion. But scanners are kind of taking over.
All right, I'm gonna explain what happens when you get a dental cleaning.
Dr. M.
So the first step is we start using hand instruments and something called a sonic scaler or ultrasonic.
So dental students actually have to do their own cleanings for 2 years. It's super unfortunate, but we learn how to basically do everything that a hygienist does. I always started out with an ultrasonic scaler on natural dentition. So if a patient has their natural teeth and they don't have like crowns or anything else that's a little bit more intricate, I would start out with an ultrasonic scaler, which is what's being shown in the video here. And then I'd follow up with hand instruments to kind of get anything that was left over. But I'm not really doing those anymore, thank goodness.
So this is a young lady who started to use oil pulling, and she claims she removed plaque out of her tooth. Well, that's not really plaque. When it's dark brown black stuff stuck underneath the gum line, that's calculus. And really the best way to clean that is through a professional dental cleaning.
I've had a lot of people in my life ask me about oil pulling. I don't know a ton about it. I've looked at a little bit of the research here and there for like 10 minutes, trying to figure out what it is and if it's actually effective. And from what I can tell, it seems like it may be effective, but for the cost and for the time that it takes to do, I don't even know if it's worth it. Just take good care of your teeth. Use a good oral health regimen. Brush, floss, irrigate, do all of these things. Do it twice daily or more. Take care of your teeth, and in the long run, you will keep them. It's as simple as that. Oil pulling is like one of those fads that I don't know. I just brush, floss, and irrigate people, and get cleanings every 6 months unless your hygienist says you need them more frequently. Get rid of calculus, stay with the program, you've got this.
This is what it can look like if you're ever getting a professional teeth whitening procedure.
This is Joyce the dentist. She's one of the TikTok dentistry goats.
This green stuff that they're putting around is called a liquid dam. It is nice and gel-like.
Yeah, and then this is just a whitening video. This is really common. People are always asking about whitening. Obviously, everybody wants white teeth. We always tell people the most important thing thing. Take care of your teeth first and foremost. Make sure that they're healthy. Your teeth, your gums, your bone, everything is healthy before you're worrying about freaking whiteness. But this is an in-office whitening, which is effective. It is not the only way to whiten. You can do at-home whitening. Either at-home whitening or in-office whitening. Those are the two things that I would recommend. The whitening toothpastes and things of that nature, they only really go so far. So don't get caught up in the advertising of toothpastes. It's pretty much all the same stuff.
Right. Open there. Right. Open.
That's occlusion. That's checking the way the teeth come together. And so anytime we do any sort of restoration, you know, crowns or fillings or anything like that, we're gonna check occlusion and make sure that your bite is functioning properly and that's gonna feel normal for you and you're not gonna have any crazy biting forces, occlusal forces on your teeth. I don't know if this person might have a bunch of crowns. I think that's probably what this is. Or else they just have really nice teeth.
So what's up, guys? This is a patient who has not been brushing their teeth for probably about 15 to...
I feel like the majority of videos on TikTok about dentistry are calculus removal. I get it. It's like somewhat satisfying to watch. Just the fact that people let their teeth get to this point is wild to me, but I've seen it myself. I haven't seen anything like insane, but I've definitely seen big calculus bridges. It is satisfying to get rid of those, to clean the teeth up.
And that is a huge, huge chunk of calculus.
This guy's cool. Dentite.
That has built up underneath the gum line.
Yeah, that level of calculus is just eating away at the periodontium. Most of the time when people have something like that massive chunk of calculus for many years, you're gonna end up losing the teeth that are associated with that calculus. A lot of times if it's in the entire mouth looks like that, you're gonna end up in dentures, which is super unfortunate. Sometimes you'll see these cases where there's like class 3 mobility, the tooth's just floating in the wind. It's going out.
I started feeling pain in between these two teeth and I thought I just had food stuck in between them. I had a friend dig in my teeth and we found a cavity, but it doesn't end there. I scheduled to see a dentist as soon as I can and everything seemed fine at first. Would you be able to check the rest of my teeth to see how those are doing? And the results will shock you.
So we got one here, we got in between the teeth on this side.
I thought I only had one cavity, but they found 10. And if they fixed them, it would be with resin composite. And it's not cheap.
So if you're gonna get braces, you should go to a general dentist before going into orthodontics. This person obviously got braces without being checked out by a general dentist and they were filled with caries. They had all sorts of stuff going on that needed to be addressed before ortho. I guess this happens in private practices and in orthodontics where people want braces and I guess they have the money or whatever to spend on braces. They skip the step of going to a general dentist and fixing everything else before going into ortho. Bad practice, do not do that. You can end up like this guy and spend just a ton of money on a bunch of composites. In the very little I saw of the video, I didn't see like a ton of caries, but you never know. This dentist made a diagnosis and that's unfortunate. I don't know why that guy, I don't know why he reacted like that. It almost looked fake to me. What I suspect probably happened here is that he already had that tooth chipped in the past and it was restored with a little composite, just a little incisal edge composite, and that thing just popped out. That's what I would guess is going on in this video. If you have an incisal edge chip and you have it restored with a tiny little bit of composite, it might last for a couple months, might last for like a couple years at most, but it's certainly not gonna last many years. Those things have to be replaced constantly.
There's no way. I've literally had this retainer in for what, 5-6 years since 2008.
Dude, everyone knows you can take out your retainer. I'll show you.
No, you can't take a retainer out.
Yeah, you can. Watch.
It's permanent. They put there's glue in there.
Everyone knows they come out.
Oh my god, look how white my teeth are.
Yeah, that's fake.
Did you know people are shaving down 60% of their teeth in order to get the perfect smile?
Yeah.
This TikTok trend sees people flocking to dentists to improve their pearly whites by replacing their teeth with veneers.
Those are crowns.
Those veneers aren't even real.
Crowns.
They're actually crowns.
Crowns.
Veneers just cover the front of your tooth, but crowns cover it all, meaning your real teeth will look like this when the procedure is over.
Yeah, I think this is a big thing in other countries. People go to countries like Turkey and they get their teeth, they get crowns on every single one of their teeth. This is just, don't ever do this. Just don't ever do that. It's, oh my gosh. One thing that we in dentistry have the responsibility to do is to prevent people from doing this. For the rest of your life, you're going to have to maintain crown margins on every single one of your teeth, and one or many of them, if not all of them, are gonna fail, especially if they're all done at the same time like this, where a great deal of attention can't be put into the placement of the crown. I can't even begin to describe why this is so bad. I imagine most of these people who are doing this like in their 20s and 30s, they're gonna end up a dentalist by the time they're in their 50s, if not earlier. And that's super unfortunate. I know we have like implant systems now where we can build hybrids and stuff, but these people are generally healthy, you know? And if you're a dentist or dental student, don't ever freaking do that, man. Seriously, let's do like dental school and see what's on dental school TikTok.
Day in the life of a dental student, but no voiceover, just vibes.
Vibes.
He just said we can use our notes. Show him. Wow, what a great guy, what a great guy. Final exam. So now we're gonna head up to...
I feel that.
This is the iconic Dr. Dovek. What did you think about my...
Dude looks like a legend.
So basically, in 30 minutes, we're gonna have a hand skill practical where we have to make this little nub look like this with wax. So hopefully it goes well. We have
this is D1 year. Okay, you're funny. This girl's good. This is D1 year. This is classic D1 first year dental school. I love teachers like that. I love the old teachers that are just freaking legends. I love those types of people. We had plenty of them throughout our experience in dental school. They help you out. They build you up when you need it, especially like in D1 and D2 year when things are rough. It helps to have people like that. Yeah, a lot of this stuff I've talked about in the past, just diversifying what you do in high school and college to build up the resume that you will approach dental schools with. All of that stuff's gonna help you get into dental school. The most important thing though is like grades and DAT. If you can get really good grades and kill it on your DAT, you have a great chance of getting into dental school, but make sure you're doing the shadowing and all that other stuff. It's all super important. Should I do videos like this? I don't know why I have never done a video like this. Like, it's simple. I could do that for sure. Let me know if you want to see videos like this. But yeah, one of the things you need to notice about this video and like my videos that I've made on YouTube, dental school, you have to do freaking everything for yourself. You have to pour up all your impressions. You have to clean your room and flip everything. You have to do sterilization. You have to schedule patients, money stuff. Like, there is so much that you have to do as a dental student. It is insane. So I think the purpose of that is to make you appreciate having a dental assistant, because when you're out of school and you have an assistant, they'll do all that junk for you. It sucks, it's hard. That's why like she's adding the times to all of this, and it makes sense. Like, this stuff takes freaking forever.
If I learned anything in dental school, it's to mind my own business and stay in my own lane. The time
Preach.
I spend looking to my left and looking to my right, seeing what Billy and Sally are doing and seeing if their work is better than mine, it's literally not making my work any better. If Polly Pocket went to Chicago for the weekend, but I'm spending my weekend studying, that doesn't take anything from me. I'm not always going to align or be the same thing as someone else's needs. If I learn anything...
Is she doing a cleaning with, wait, is she in dental school or hygiene school? Is she doing a cleaning with a dam on? That's crazy. But yo, shout out to you, Jackie. That is a great message. I've told people this for years. Do not compare yourself in dental school to others. It is a recipe for disaster. Do your own work hard, and try to learn at your own speed, but don't sit there and look at other people's work and feel bad about yourself, because there are gonna be people in dental school that you like that just blow your work out of the water, and it's kind of annoying and frustrating at times, but I promise you, if you keep your head down and do your own work, stay in your lane, you will get there on your own time. And by the end of it, you'll think, you know what? I didn't need to worry what that guy's wax up looked like D1 year. I just needed to do things on my own speed. What is it? Stay in your lane, do your own work hard, and you'll get there in the long run. I don't know. Hopefully this video is interesting. I'm not a TikTok man, you know? I don't know TikTok. I know YouTube. I've been on YouTube for many years. And if you enjoyed this video and you want to see more videos like this, or just more videos about dental school and dentistry and all this whole world, let me know, because I'm gonna do more of this stuff in the future. I think it's fun. I think it's informative. There's definitely a lot of stuff out there. There's more stuff about dentistry out there now than there was when I was going through as a pre-dental student. And I really appreciate that. Anything that we in the dental profession can do to help people out that are approaching the profession as prospective dental students, I think is helpful. And that's why I have this channel. That's why I make these videos. So hopefully you've learned something from all of the people whose videos I just reacted to, and hopefully you enjoyed watching me react to videos. I had a good time with this. Like I said, if you want to see more of this, let me know in the comments, and like the video, subscribe to the channel, do all the things that YouTubers tell people to do, and I would greatly appreciate you. Thank you all so much for watching, and I will see you in the next one.